In the clinical laboratory, usually the hematology department, we may be requested to perform synovial fluid crystal examinations of synovial fluid collected by the healthcare providers. Typically, cell count, differential crystals, gram stain, and culture will be ordered. Depending upon the lab protocol, crystals examination may be performed in a white top collection tube without additives. Powdered EDTA in a lavender top may theoretically interfere and be misinterpreted as endogenous crystals. Healthy synovial fluid is normally highly viscous due to the hyaluronic acid. Reagent hyaluronidase enzyme may be added to digest hyaluronic acid to reduce the high viscosity, making it easier to examine by automated instrumentation and microscopy. Polarizing light filters apply to our needs in everyday life. And in the clinical lab, when we need to examine joint fluid for crystals in the polarizing microscope, two filters are applied. The rectangular polarizing filter goes into a slot near the microscope eyepiece, and the round one goes near the light source. The upper red arrows point to the lever that allows you to change the orientation of the polarizing filter 90 degrees back and forth. Both filters are positioned perpendicular to each other. Without going through the detailed physics, a basic explanation is that this special microscope allows us to distinguish a physical property of crystals called anisotropy and birefringence. As polarized light goes through the crystals in the joint fluid, ordinary and extraordinary light rays are out of phase. And when they recombine after interference, they generate an image contrast that changes colors as you rotate the eyepiece filter 90 degrees. Here we see a colorful, bright magenta background with neutrophils and monosodium urate crystals that appear long, needle-like, some extracellular, some intracellular, and yellow crystals oriented one way and blue crystals oriented perpendicular to the yellow ones. When you rotate the polarizing filter 90 degrees, you see the same crystals change colors from yellow to blue and blue to yellow, depending on their orientation to the polarizing filter axis. This is called negative birefringence, consistent with monosodium urate crystals seen in synovial fluid of patients with gout. In contrast, calcium pyrophosphate crystals appear thicker, rhomboid shaped, with the opposite colors when looking at the polarizing axis. Parallel crystals appear blue, and perpendicular crystals appear yellow. When we describe synovial fluid crystals, we describe the shape, whether they are intracellular, extracellular, or both, and if they demonstrate negative or positive birefringence. We add at the end of the report the clause consistent with monosodium urate crystals or consistent with calcium pyrophosphate crystals. Gout is caused by hyperuricemia. There is an overabundance of crystalline monosodium urate or uric acid crystals in the joint fluid. Gout typically affects the joint in the big toe in about half of all the cases, but it may affect heels, ankles, knees, wrists, and or finger joints as well. Pseudogout is chondrocalcinosis caused by an abnormal buildup of crystalline calcium pyrophosphate dihydrate crystals in joint cartilage and fluid. Pseudogout most likely will affect the knee joint first, but it may also affect other joints. There are other crystals rarely found in synovial fluid. These two are the most common crystals found in synovial fluid. For your information only, it is very rare to find these other crystals in synovial fluid, but they are mentioned in the text source and the ASCP study guide. Thank you for your time, attention, and support, and we hope to see you in the next video.